In this video, we're going to go over how to insert a nasogastric tube. So to start, you're going to check your order and policy regarding the type and use of the nasogastric tube, and then you're going to gather your supplies and check the integrity. The supplies you'll need include the sized NG tube, gloves, tape, water-soluble lubricant, tissues, emesis basin, half a cup of water and a straw, catheter tip syringe, and a safety pin. Then I would provide privacy by closing the curtain, and I would ensure that my workspace is clean prior to laying out all my supplies, and I would do hand hygiene. Then you would correctly set up suction if ordered by the physician. Then I would enter the patient's room and introduce myself and ask for their first and last name and date of birth, as well as allergies, and confirm their R band. Then I would ask how they want to be addressed and what pronouns they use, and explain the procedure to the patient and obtain verbal consent. Then I would assess for history of nasal surgery and assess which nostril has greater airflow by instructing the patient to breathe normally and including each nostril one at a time. Then I would explain the procedure to the patient and set up a distress signal and teach them how to dry swallow if NPO. I would also ensure that I'm on the correct side of the bed and that the patient is in the high Fowler's position. Then I would place the towel over the patient's chest, ensure my emesis basin is within reach, do hand hygiene, and don my gloves. You're going to measure the distance from the nose tip to the earlobe and then down to the xiphoid process, and then you're going to mark with a piece of tape. You're going to lubricate the tip of the NG tube with water-soluble lubricant, ask the patient to bend their head back, and you're going to insert the tube into the nostril, directing it downwards. When the oropharynx is reached, you're going to ask the patient to bend their head forward and give the patient the cup with water with a straw and help them swallow or dry swallow if NPO, and you're going to advance with each swallow. If resistance is met, you're going to rotate the tube gently and attempt to continue to advance, and you want to check to ensure that the NG tube is not coiled in the patient's mouth. Then you would insert the tube until it reaches the tape, ensuring not to force it, and you would tape the NG tube to the nose, like so. Then you would confirm placement with an x-ray, ensuring to check hospital policy for placement check, and you would attach the NG tube securely to the patient's gown. Then you would attach and turn on suction if ordered, and for Salem sump NG tubes, you would attach the anti-reflux valve like this. Then dispose of your equipment properly, clean the surrounding area, and perform hand hygiene. Then reinforce teaching, assess the need for restraints, reposition the patient, and perform safety checks prior to leaving the patient's room. Additionally, ask if they have any questions, ensure they are comfortable, and offer oral care every 2 to 4 hours. Then chart the procedure.